Hi, I'm Dr. James O'Donovan, and today we're going to cover key things that you need to know about cocodamol, a combination painkiller made up of paracetamol and codeine. Now, it's typically used to treat types of pain including headaches, muscle pain, migraines, and toothache, and it's especially helpful when common painkillers like ibuprofen or aspirin aren't effective or they're not working. Now, in this video, we're going to cover several key important things that I think you need to know about cocodamol, including who can and can't take cocodamol, how and when to take it, side effects, potential interactions with other medications that you might be taking, as well as common questions that I'm often asked and additional resources. But before we start, what exactly is cocodamol and how does it work? Well, cocodamol contains two medicines, paracetamol and codeine. These two painkillers work in different ways to relieve pain. Paracetamol seems to work by blocking chemical messengers in the brain that tell us that we've got pain. It also helps by reducing high temperatures by affecting the chemical messengers in an area of your brain that controls body temperature. On the other hand, codeine belongs to a group of medicines called opioids. Now, these medicines include things like morphine. It affects pain receptors and helps the brain to block pain signals to the rest of the body. Now, when codeine blocks the pain receptors, there can be other unwanted effects like slow and shallow breathing, and it can also cause slowing of digestion, which is why codeine tends to cause constipation. So firstly, who can and can't take cocodamol? Well, most adults and young people aged 12 and 17 can take it, but it's not suitable for everyone. Now, it's really important that you talk to your doctor if you have any lung or breathing problems, a head injury, adrenal gland issues, which are the glands that sit on top of your kidneys, seizure disorders, or if you drink more than 14 units of alcohol a week. It's also important that you tell your doctor if you're pregnant, trying to get pregnant, or if you're breastfeeding. So now let's talk about how and when to take cocodamol. Well, cocodamol comes in 3 different strengths, and while you can buy the lowest strength over the counter from the pharmacist, the highest strengths need a prescription from your doctor. Now, it can sometimes be a little bit tricky to understand the strength of the tablet and how much of each medicine is in each tablet. But in general, cocodamol tablets and capsules come in 3 different strengths, containing 8 milligrams, 15 milligrams, or 30 milligrams of codeine. Now, all 3 strengths of tablets contain 500 milligrams of paracetamol, the same as in a standard paracetamol tablet or capsule. Now, the strength of cocodamol appears as 2 numbers on the packet. For example, 500 means that each tablet or capsule contains 8 milligrams of codeine and 500 milligrams of paracetamol. Now, the key is to follow your doctor's instructions carefully because cocodamol can be addictive. Adults shouldn't exceed 8 tablets in 24 hours and should leave at least 4 to 6 hours between doses. In terms of practical tips for taking them, swallow the tablets or capsules whole with water, and if you're using soluble tablets, this means you can dissolve them in water first, and cocodamol can be taken with or without food. Now, it's important to know how long to take cocodamol for, and your doctor should be guiding you, but if you bought it at a pharmacy, don't use it for more than 3 days without consulting a healthcare professional if it doesn't seem to be working after this period of time. It's also important to know that taking too much cocodamol can be very dangerous, and that's because the paracetamol in it can cause liver damage. Don't increase the dose of cocodamol or take more than 2 tablets at once, even if your pain is very bad, and talk to your pharmacist or a doctor if you think the dose is not enough to help your pain, and they might be able to recommend other alternatives to help you. It's also important that you don't take paracetamol at the same time, because obviously cocodamol contains paracetamol, and remember that it can be addictive. So now let's talk about potential side effects. Whilst many people experience no or mild side effects, common issues can include constipation, nausea, dizziness, sleepiness, and headaches. Now, if these persist or they become problematic, it's important again to speak to your doctor or pharmacist. Now, for serious side effects like breathing difficulties, seizures, or severe allergic reactions, it's really important that you seek medical help immediately. It's also important to be aware of possible interactions with other medications that you might be taking, and that's because cocodamol can affect how other medications work, including sleeping pills, antidepressants, and medicines for blood clots or infections. Now, it's generally safe to take with ibuprofen and aspirin, but you should always avoid other medications containing paracetamol to prevent overdose. It's also important that you read the information leaflet inside the pack fully before you start taking it. Finally, let's cover some common questions that people often have about this medication. So first of all, people often ask, how long does it take to work? Well, generally cocodamol starts to relieve pain about an hour, but this can vary from person to person. Other people ask, can I drive or operate machinery? Well, it's important that you don't drive a car, ride a bike, or use tools or machinery if cocodamol makes you sleepy, gives you blurred vision, or makes you feel dizzy, clumsy, or unable to concentrate or make decisions. Now, this might be more likely when you first start taking cocodamol, but it could happen at any time. So, for example, when using another medication. It's really important to remember that here in the UK, it's an offence to drive a car if your ability to drive safely is affected. It's your responsibility to decide if it's safe to drive, and if you're in any doubt, don't drive. Even if your ability to drive is not affected, the police have got the right to request a saliva sample to check how much cocodamol is in your body. Some people also ask, can I drink alcohol with it? Well, it's best to avoid alcohol, especially when you first start taking cocodamol or if it makes you sleepy. Other people ask, can I become addicted? Well, if you start taking cocodamol regularly for a long time, you can become addicted to the codeine in it. You're unlikely to become addicted if you follow your doctor's advice carefully about how long to take it for. And if you've bought cocodamol at a pharmacy, always follow the instructions that come with the medicine. And remember, only take it for a maximum of 3 days at a time. If your pain is not better after 3 days, it's important to speak to your doctor for advice about further pain relief. It's also really important that you only take cocodamol for the shortest amount of time possible. Now remember, these are not all of the side effects or interactions, and remember, for a full list, always check the information leaflet inside your medication packet. I've also included useful links in the description box of this video with more information from the NHS website if you're pregnant, breastfeeding, or trying to get pregnant, or if you want to learn more about cocodamol. This video was just intended as a general guide and educational resource. I am by no means promoting cocodamol use, but it can be a useful pain relief in certain circumstances. Now, if you do have any questions, please post them in the comments section. Once again, thanks for watching. I hope you learned something new, and until next time, bye.